It is time for another Y107 MU Healthcare's Ask the Expert podcast. I'm your host, Cosmo, for the Y107 Morning Show with Cosmo and Lauren. And MU Healthcare's Women's and Children's Hospital committed to empowering women through the prenatal and delivery process. OBGYN Ella Speichinger is joining us here on this Ask the Expert podcast. And I understand that you offer low intervention birth program. Why is that important?
So the goal of low intervention is to basically give more options to pregnant women. When you think of low intervention, most people think of an unmedicated birth that maybe doesn't have epidural or Pitocin, which is a medication that speeds up labor. But I think a more accurate description of that is thinking about what interventions are necessary to have for a safe delivery and only doing those. And so a woman who has high-risk pregnancy or needs more intervention, we offer those things. But for a woman who has an uncomplicated birth, basically that over-medicalizes what's otherwise a normal human experience. And so we can offer the safety of a hospital delivery with the comforts of being at home, whether that's laboring in a tub, being able to walk around, having a more ample bed, knowing with reassurance that if you need those extra things, they're available to you.
Now, how is MU Healthcare on the forefront of innovation when it comes to patient care, doctor?
So MU is the only hospital in Columbia that offers group prenatal care. And in order to describe group prenatal care, it's probably better to know what is individual care. So a pregnant woman will come and meet her OB provider probably about 10 to 15 times. That first visit's like 30 minutes, maybe a little bit longer, and then has 10-minute visits thereafter. Not a whole lot of time to ask questions. If you have uncertainties, get more education. So the group prenatal care, which is also called centering, provides that individual care, but on top of that has more time for education, and also you learn from the experience of other pregnant women. So the group basically consists of probably closer to 8 to 10 women with their partners. They have that individual care initially, and then also after that meet with other pregnant women to have education support and other just built-in support. Group prenatal care, it's actually been shown to decrease preterm delivery, decrease time in the NICU if a baby has to go to the NICU, it's decreased low birth weight babies. If a woman has gestational diabetes, which is diabetes in pregnancy, it's been managed better, and it may even decrease the risk of postpartum depression. Not all women are going to pick this, but for women who want more time with their provider and more education, this is a great option for that.
Doctor, why is it so important to pick an experienced team of doctors when you're expecting and getting ready to add to that family?
So most women's pregnancies aren't complicated, but there's lots of unknowns that happen in pregnancy that may develop over that time. We have the most comprehensive women and children's healthcare team in mid-Missouri. So that includes midwives who are trained in informed trauma care. That's obstetricians and gynecologists who have both excellent bedside manner and superb surgical skills. We have maternal fetal medicine physicians who consult in our highest risk pregnancies. And for those babies that may need a NICU stay or a neonatology expertise, we have a full NICU team that consults before and after delivery. And they're all housed in the same place. And that just provides excellent safe care.
We've got Ella Speichinger, OBGYN, with us from MU Healthcare. Women's and Children's Hospital, it's the only baby-friendly designated hospital in mid-Missouri. Can explain why that is significant.
So the concept of baby-friendly really just means giving mom and baby the best start. It traditionally talks mostly about breastfeeding, but that is not the only way to feed your baby. And so really, for moms who want to breastfeed, we give her all the tools to be able to do that safely and effectively and to be able to maintain that as long as she wants. For moms who want to formula feed, we teach them safe formula feeding techniques, or if they want to combine, how is the best way to make that successful. No matter how a mom decides to choose to feed her baby, what we do is give lots of hands-on contact, lots of support, and teach how skin to skin is such an important concept at the first part of life. Skin to skin, which is basically where baby is with mom or support partner as much as possible, skin to skin, decreases NICU time. It's been shown to regulate breathing and temperature, and babies actually even just cry less with skin to skin contact.
Sometimes a C-section is necessary. Now, what is a gentle